we are actually producing lots of doctors. We are producing them in South Africa, we're producing them in Cuba. There's a whole program that is funded by the South African government that's actually in Cuba at the moment. So we are producing doctors. But shame, I don't want to say the joke, but the thing is, we are not employing our doctors. So we are finding large amounts of unemployed doctors sitting in South Africa. My friends, myself included, out of my group maybe of 10, 15 people, 3 of them have formal employment. Does that make sense to you? Does it make sense to our fellow South Africans? Well, it shouldn't. We are doctors sitting at home looking for jobs. So I'm Salwah, and I'm born and bred from Cape Town, and I currently live in Kensington, and I'm 28 years old. When one asks about yourself, it's kind of a lot to ask, but just quickly, I identify as a South African, as a female, as a woman, as a daughter, as a friend, and also just a citizen of this country. And I see myself as a community member. And currently I'm working as a medical doctor, currently formally unemployed, but I am locuming at the moment. And yeah, that's just a little bit about me.
All right, thank you very much. So let's talk about being a medical doctor in South Africa, but let's start at your journey specifically. So you have been helping people from a very young age. So please tell us a bit about that early involvement in community service and development. Okay,
so I'm like I said, I'm from Kensington, which is a predominantly like a colored community, and I went to Kensington High School. I think from an early age, from primary school actually up until high school, I was always faced with these very much normal circumstances to me, which I was mixed with a group of people that were ranging from very unfortunate or less or disadvantaged to I wouldn't even say middle class, but right above middle class. And there were a lot of challenges in the community, like drugs, people dropping out of school, teenage pregnancy, rape, gangsterism. It was just like a mixed bowl of a lot. And I knew when I was faced, or as I was growing up in those circumstances, I decided for myself, like, I cannot find myself stuck in this. I can't be another number to this terrible statistics that we face. And I knew also from a very young age, naturally, that I wanted to help. I didn't even know at one point. Like, I was very interested in the environment, in science, in human nature, psychology. Those were all of my interests. History, politics, like that was just my range of interests. But by the end of, I would say like grade 9, we had to choose our subjects. And I was like, no, this means I need to choose a direction. And I knew I liked science, so I naturally chose the sciences. And then, because what was strange is that actually from primary school, I actually wanted to be a psychologist or a social worker. That was my main, that was the main thing that I wanted to do. I decided that's what I wanted to do. But then I think puberty and just being a teenager and all of that, you're just faced with a lot of, like, there was just too much stress. And I couldn't actually deal with even my family situation at home, because I was faced with these challenges at school, and then in my family we were also faced with a lot of emotional, stressful things in life, which range from lack of finances in the home, because my father wasn't working, was medically boarded at the time. My mother was the sole breadwinner who didn't finish school, but she's amazing with her hands, so she did everything. She's a dressmaker, she's a baker, she can do everything. And she brought us, like, literally 4 kids. She took us through school and to university today. So at the time it was very challenging to decide a career, because for me a career meant not only my form of income one day, but just also like a way of life, and also it meant to bring a family out of what I didn't see as ideal. Although this was not unique to me, lots of my friends and people in my class were going through the similar things. So it was like a lot going on in that 5 years of high school. And I think also an incident or two happened during, I think it was grade 10, where like I was faced with friends having abortions, friends being involved in gangsterism, friends being drug addicts, family being on drugs. So at that point I was like, I got nervous about thinking about psychology, to be honest. That is exactly what happened. And I was like, you know what? I don't think I'm emotionally capable to handle all of that. And I decided, okay, I still want to help people. I still want to help the community I'm in, but what can I do? And then I was like, you know what? I love the sciences. I like people. And I thought naturally being a doctor is what it looked like. And although I wasn't there yet, at the same time I thought I also wanted to be involved in getting to know people beyond what I do know. Because growing up in a community where you're only mixing with the same, I wouldn't say the same kind of people, but people who are from similar backgrounds. And that bothered me, living in South Africa, knowing that like Cape Town is like a vast, big variety of people who are so different, such a multicultural place. And so is all South Africa, but just where I was at. And I also found that strange that I wasn't mixing with the rest of my people of the world or of my country. And I always found that to be like a strange dynamic. And then, I think I was 15 years old, and a cousin of mine told me, don't you want to go on this camp? And I was like, what is this camp about? I literally didn't know much about it, but it was an interfaith camp. And it was called Face-to-Face, Faith-to-Faith. So it just brought people of many nationalities together, different religions. And it starts in Cape Town. And then I met people from all parts of Cape Town, people that I never have met before if it wasn't with this program. The first time I met a Jewish person, that was it. The first time I met people from who are atheists, like that's not even a thing you speak about if you are from like small communities. That's not a thing. So like it was just like this world of exposure that I never even knew existed. And visiting people in the township, something that I never did before because I didn't technically have friends there at the time. So I think from a young age, my interest in meeting people and just trying to move beyond those boundaries, it was a big thing for me, and it was something that I wanted to continue to do. So that is like at the age of 16, 17, I was going through career. I want to meet people, I want to go beyond barriers, I want to understand the other, because I thought we were very limited. And I also had this impression that only affluent people or only white people would go to university and do these great things, because that was the mentality that I was surrounded by. And by the time I got to university, it was like a whole culture shock of things that I've never been exposed to before, meeting crazy people from different backgrounds, and also like from education levels or from educational institutes that I could never even imagine attending. Like it was just crazy that how different our educational experiences were.
I want to jump in there.
Yes.
If there's a young person watching this, there's this interest, and now your worldview is now a little broader, and you have a choice. So how did you make that choice? And why did you choose then the university that you choose?
So I knew I wanted to become a doctor. I didn't even know that I could apply to beyond the Western Cape. Like when your mind is so, I wouldn't say shame, so narrow, but like if you're not exposed much, you don't think, for some reason I didn't think I could leave the Western Cape. And that's basically how I ended up at Stellenbosch. As silly as it sounds, but as a 17, 18-year-old, I didn't actually know that I could apply to a university even outside my city. And so I didn't. And I ended up at Stellenbosch University. Yeah. So.
Okay, so now you're at Stellenbosch University. Was it your only choice, your first choice, or was there other choices?
Yeah, like I applied to UCT, UWC, and Stellenbosch, and yeah, I chose Stellenbosch in the end because also the bursary opportunities were better at Stellenbosch than at other institutions actually at the time.
All right. So which lead me then to the next question. So now you're Stellenbosch, and you've made this decision to study medicine. How was that journey?
Sure, that's like a big that's a big one to just ask, like, because it depends on where in the journey I was at the time. But I mean, if I could describe university in like one word, I'd say tough. That's literally what it was. It was exceptionally difficult. I didn't find the process easy. A lot of the time I didn't find it pleasant at all. It was a very cutthroat environment to be in. Because, from so many aspects actually, because like coming into it, like I mentioned earlier, is that first of all, it was a culture shock for me. I was never in an environment where I was mixing with so many white people. That's a fact. That was never, where like almost 60%, if not more, of the class were white. And the rest were Indian, colored, black. It was all just like a mixture of people. But the majority were white people. And even coming into that environment was very shocking for me because never learned in this. And growing up in a colored community where even your classmates were only colored or black, nobody else. And you also grow up in a society that whether we are living in apartheid or not, we grew up in this era of still having the constructs in place, although not labeled or called by those names anymore. It was the constructs were still there. And so naturally I'm as embarrassing as this is, but I feel like at some point I was like really having an inferiority complex about it. It really got to me. I think especially the first year, because I also felt like I needed to like prove myself in a way, just to make it. And then, I mean, once I got over that, it was more like, okay, we're not actually different. We are the same. Your knowledge is not different to my knowledge, or your accent doesn't make you better than me. Like, and I think accents just in South Africa is such a big connotation to that, and it's so annoying. And I feel like that's a whole video for myself that I need to make one day. But we can talk about that for hours. But I'm very like passionate about being myself, and so finding myself in this place where I felt out of place was difficult. Just that, because I always found that my friends or people, like I actually went to university with 3 of my very close friends, so I had them, but we find ourselves like people who are similar to you be changing so that they can fit this mold that seems to be professional or seems to be the smarter one, or suddenly like just changing things about yourself to fit what in this profession, what a doctor would look like. And I was never comfortable with it, and I'm still uncomfortable with it. So I try my best not to do that. Yes.
I want to quickly jump in there with regards to what the idea of a doctor looks like, because that's an interesting point that you're making. So what is this idea, and how long was your journey until you were a qualified professional?
Okay, so I did a 7-year degree, and then you do 2 years of internship and a year of community service. So it's 10 years, but 7 years to to be officially a doctor, and then just the internship is the training part, and the community service is also just community service as a formal medical officer, but it's for the country. But you can't work in South Africa as an independent practitioner without completing those 3 years post graduating. Yeah.
Okay, so it's and I get it. It's tough. 7 years, and it is and I think there's a pressure.
Yeah, no.
Pressure of failing or dropping out.
Yeah, because
so talk to me about the dropping out.
Sure, I must say.
How many were you guys, and how?
I don't know how to happen, but our dropout rate was not bad. Like, definitely there were people who were dropping out, but not historically crazy numbers. Like, I feel like most people, like, we started off, I think, if I'm not mistaken, 300 people. We ended off with basically 300 people, more or less, if not a little more, because even though you do fail, the people will carry on and they will just join your class like that. So I must say the dropout rate is not that crazy, like crazy numbers. I can't give you the exact numbers, but I know it's not these large numbers. But there are definitely people that I met in my degree that have dropped out. But even though people do fail, they actually just redo that subject. Because in medicine, it's a bit of a unique program. If you fail a subject, you have to redo the year. And redo the year, not meaning completing all the other subjects. You only do that one subject for the whole year. You can't even take on another module. So it puts you back. It's terrible. That's why as medical students, you really don't want to fail, because that means you will just do that one subject for the whole year. And you can't even attempt another year. So you have to complete everything to move on to the next year. So there's a lot of pressure with it. So what I found actually is that even in 5th year, I think I just know 1 or 2 people who actually just stopped. But it's not many. And most people actually they sacrifice that year if they do fail, and then carry on and just join the degree again. That's how it was.
Okay. So talk to me about this idea of being a doctor.
I think our South Africa's idea of being a doctor, or societal's view of being a doctor, is very unique to South Africa at this point, because previously our doctors looked a certain way, and especially with our very historic identity of apartheid lurking there, it was very normal for most doctors to be white men, even not only white but men. And so that fits the mold. It was a very common mold that people would see and that must be the doctor. If there's a group of us walking through the passage, who's the doctor? It's probably the white guy, and it was something I still face today. People think I'm a nurse. Not that a nurse, that's a great profession. There's no shame in that, and there's nothing to feel any different, but people wouldn't naturally think doctor, they would think nurse first. And most, historically, even in South Africa, most nurses are female. That is true, but not necessarily today. And that is something that is such a common misconception in the time that we are living in still today.
Right, thank you.
Yeah.
So then the next question, is picking up on your journey, is that you then did your community service after that. And this brings me to where you did it. You did it in rural area, and why do you think, based on your first-hand experiences, that rural communities have a lack of access to healthcare? What is your views on it? Why do you think this is the case?
So I did my community service in a town called Jagersfontein, which is in the Free State, and it served a very large rural community. So areas like Koffiefontein, Lukhof, Jacobsdal, Itumeleng, and Fourie-Smith. So it was these little towns around or surrounding Jagersfontein. So it's about 5 towns. I think I'm leaving out one town, but anyway, it's a very, very rural area, and I found myself there because I was placed there by the HBCSA or the ICSP, which is part of the South African Health Department's way of placing health professionals. So I was placed there. And just coming to your question of how is the resources, or why is it, or the lack of resources in the rural areas. So this is just my personal opinion, and so is everything I've said today, most of it. And I found that I've now worked in the city and I've worked in rural. And if I compare my two experiences, so I worked previously in the Eastern Cape, in the city, and now there, if I have to compare it, it's vastly different, but also very similar. So in the South African context, you must keep in mind that there are different health departments at play. You can't just say, in South Africa, this is how it is, because that's not the case. You get different health departments for different provinces. So in the Free State Department of Health, I found that, especially in the rural areas there, it's so under-resourced. So, understaffed is you can say, it depends. But you'll find facilities not being run according to a standard, which they should be throughout South Africa. So in certain hospitals, you find that there are no specialists, or not even one specialist, because you need to have this, like hierarchy is a contentious word in the medical fraternity, because that covers something else. But in some way, you actually do need a level of expertise to cover a facility. And you'll find many facilities in the rural areas don't have that. That structure is not there. The governing bodies or the protocols are not there. And I find that it falls under the rug very quickly compared to the city, because no one is keeping tabs on what's happening there. And why do I think it's happening? I think naturally South Africans, a lot of them move to the city. It's a normal urbanization, migration that is very natural in the South African context, because people don't want to be in the rural areas. The access to water. In the Free State, people don't have water. I didn't know that till I got there. I see my neighbors saying they must catch water because the municipality doesn't provide water, and if it does, it's dripping. You can't drink water that's dripping. You can't washing with water that's literally drops. So if you don't have money to put in a bowl, you won't get water. And that was what the communities were facing there. I lived in a very, very poor community. People don't have water there. It's a luxury to have water. If you're rich, you have a bowl. You see, so for me, I was flabbergasted by the basic needs of communities that weren't met. And then you find the healthcare is subpar, not fair, unequal if you compare it to what's going on in the city, which has its own politics, and it's very complex, because I can't even understand what's happening in the rural areas. It makes no sense to me. And that goes to why people don't want to work in the rural areas. Like, I went there for my community service because I was placed there. People don't naturally go there because you're working in suboptimum conditions where you don't have access to the drugs that you need. You don't have access to the equipment that you need. You're supposed to do your job, but you don't have the tools. You can have knowledge in your head. You can have skill. If you don't have tools, you can't do your job. And I found working there, I felt paralyzed or disabled by the lack of, basic things I needed. Sometimes there's no ambulance. Then you just need to sit with that patient because they can't get to the city to go to the tertiary hospital. So, and here, like, I mean, basic drugs that you need for an emergency, they didn't have. At one point, we ran out of adrenaline. Adrenaline is a resuscitative drug, the first drug you go to when you're busy in a resuscitation, in CPR, and you can't get, basically, you want to bring someone back. That's the drug you need. We didn't have it at one point. Sometimes the hospital didn't have water. You can't work in conditions where you want to do your job. Like, if you want to know why health professionals don't want to work there, it's because you must deal with suboptimal conditions. Why would you want to work in a place where you must fight for drugs, fight for your patient to go over, fight for your patient to get the ultrasound, fight for your patient to get the X-ray? It's when your job becomes like for me, I wasn't practicing medicine anymore. I was doing damage control for that year, and it is very difficult.
Can I ask you a question with regards to that? Because I think doctors get a lot of flack for not wanting to go to rural areas. But is it your sense of responsibility? Knowing if you go there, it's almost kind of set you up for failure, because there's this immense responsibility that you have, and knowing that you're not going to have the resources is just going to kind of you're going to shoot yourself in the foot.
Exactly. Like, if there's anything that I've learned is that you can have good intention, you can have like this, you can be very passionate about something, but you can really be broken down by the challenges that you actually didn't even anticipate. And even when you try to fix something, it's actually, you fight the losing battle, because it wasn't you weren't the problem. You went into a system that was already broken. So if the system is broken, how can the laborers of that system work? How can they? And that's what I found. I became really despondent to be working in these conditions. It really made me lose spirit. And not that my sense of community is gone, but I actually noticed that the problems were bigger than what were on the surface. Much bigger. And even today, I find myself heading in a direction of my career which is not very medical. It's more like, personally, I am very disturbed by broken systems. Like, it's something that I'm very passionate about, and I am trying to find ways that I could possibly assist in. I mean, what I also realize, you can't bite off more than that you can chew. And I want to I would like to make real, but even a small but real change, if I can. And it's difficult when you're in the situation to try and get the foresight, to try and see the bigger picture, because you're actually just trying to make it day to day. You're trying to survive from today till tomorrow in order to keep going. And I did that for a year straight. I wasn't coping. And now that I find myself, I'm out of that situation, I can see that the issues were much bigger than me. It was bigger than resources. It comes from higher up. It comes from places that I could never reach in my capacity being there. And it requires lots of hard work and people who think alike and who actually want to improve the system.
Okay, I have a question for you. You don't have to answer it
Sure.
if it's too personal. How do you guys take care of yourself? Because if you're working in a broken system and you're constantly getting abused, the system abuses you constantly. Where do you get help?
So,
as medical professionals and health practitioners.
Yeah, that's such an important thing. Like, mental health and health professionals is something you might just see an advert on Facebook and like, we should be taking care of our mental health. But it's much deeper than that. It's, for me, I'm a person, I'm very much, this is what you see is what you get. And I'm very real about my emotions and how I feel and what I go through. So I'm honest about it. I'll tell you I'm struggling. I can't deny it. I won't deny it. And we're living in a culture, especially in the medical fraternity, where we wear our scars as badges of honor. And it's no badge of honor. We fool ourselves when we say, I worked 48 hours straight with no break. And we take that as a badge of honor, and it becomes like a culture in this medical profession. We literally speak, like I even got myself caught in it, and I didn't even realize it. You're accustomed to working in terrible conditions that the conversation becomes normal, or we normalize it. And that's what I found with my friends and I. Like I did my internship in the Eastern Cape, in PE, or Gqeberha now. And at the time, we didn't have like what the Western Cape has in place, where you're not allowed to work more than a certain amount of hours. You had to work until you are finished with the work. So there was nothing like post-school. Even last year, I was in the Free State. I worked 24 hours. I had to also finish my day of work. So 24 plus 8. I had to finish that, and then I could go home. So that's in the rural. There's no support. You literally, no one's going to do the work. You have to do it. So you work these ungodly limits of humanness, and we normalize this when we talk to each other. So we were part of this toxic behavior or toxic mentality, and we feed off of this in our groups and in this fraternity. And in South Africa, I don't know what one could do exactly to end this culture. I mean, we do have like the Juniors Doctors Association, where we're supposed to speak about these things and address it, but so far only the Western Cape has kind of won that battle, and the rest of the country is still suffering. And mental health, how do we take care of each other or take care of ourselves? I'm being honest about this journey my entire time studying and up till this point, and I never denied that I was struggling. So I sought help very early on in my career. While I was a student, I went to go speak to student health. I went to access the psychologist, because at Stellenbosch they do have a psychologist on site that you can make use of, and there's also student education support that you can access. So I made use of that very soon, because I was like, whatever I'm doing I can't keep up even. So I used that resource. When I finished studying and I started working, I saw a psychologist. I wasn't even going through anything. I was just like, I think the only way I'm going to keep my head above water is if I speak to someone. I mean, you don't go to the plumber to fix your car. So I was like, I need to see the psychologist if I want to survive this degree and make it out to the other side. So it was very much a conscious decision I made. And in last year, for example, I was working in Jagersfontein. There are no psychologists there. You are in the middle of nowhere. I used to see a psychologist before that, and then actually didn't see the whole year. And then at that point, I was like, I'm going to ask him if we can't do a Zoom call, because I need it. And that's how I actually sought help at the time. And if it wasn't for that, I think I wouldn't have made it, because it was difficult, it was draining, it was mentally just too much to handle. At that one point I was just like, if I don't do it, I'm not going to survive. And it was a survival thing for me. And I'm different compared to other people. Like, I don't know what generally people do, but naturally in the medical fraternity, there are lots of us who have not sought help and just support. They just go through it and suffer in silence until they break down, and you see someone disappears and someone else took their job. And that's very much a culture of putting yourself through it. Yeah.
So the one thing that I'm getting from here, and this is very revealing, and I appreciate this, is that the medical or the health profession healthcare professional in South Africa is under pressure
Mm.
and the mainstream, and it has it's affecting the people who's working in the system, and I think there's a trickle down effect. So which bring me then to the next question. Do you think more medical doctors or more healthcare professionals would solve this problem, or is it more system related?
It's a funny one, because now I can speak on both sides of the spectrum. I've been through the system of like finishing my internship, community service, and now I'm on the other end where I'm now actually formally unemployed and looking for a job. And I find that when you're in the system, being an intern, being a community service doctor, you are under unreasonable stress, where so the thing is, firstly, you actually don't have a choice to do it, because if you don't do it, you can't work in South Africa. So you must complete it. It's incumbent upon you. And a lot of the time, you don't have a choice of where you go. You are just placed in random places, and you work in conditions that are not standardized, although they should be standardized. So there's that end where, and also the Western Cape functions different to the rest of the country in terms of just working hours. That's a discussion on its own. You are in a situation that you didn't choose this place, but you're working these hours, and in terms of bodies there to protect you, it depends on facility. So you usually have intern representative councils in your internship, but it's not also standardized. It depends on where you do your internship. Community service, they usually put you in rural areas and in basically underserved communities. And there is no form of support, anything like that. You are on your own. But you're also overworked. Now you find yourself post-community service, and this is actually what is not spoken of. So yes, we need doctors. That's what everyone thinks, we need doctors. We are actually producing lots of doctors. We are producing them in South Africa, we're producing them in Cuba. There's a whole program that is funded by the South African government that's actually in Cuba at the moment. So we are producing doctors. But shame, I don't want to say the joke, but the thing is, we are not employing our doctors. So we are finding large amounts of unemployed doctors sitting in South Africa. My friends, myself included, out of my group maybe of 10, 15 people, 3 of them have formal employment. Does that make sense to you? Does it make sense to our fellow South Africans? Well, it shouldn't. We are doctors sitting at home looking for jobs, and it's ridiculous. And
so you want to tell me that there's a shortage of doctors, and then there's unemployed doctors in South Africa that is not employed by the system that is supporting. It doesn't make sense. It
makes zero sense. It's ridiculous at this point. So even the Western Cape has a bursary called the Western Cape Health Department Bursary. They have funded lots of bursaries for doctors, and the agreement is that once you finish your degree, you must work in the amount of years that you took the bursary for, or you pay it off. It's those two are the bursary requirements. Those Western Cape holder bursaries are sitting with no job, where they must be employed by the Western Cape in order to pay back their bursary. And there's lots of them. So they are even sitting at home. And then there's the rest of us who are sitting at home. And the thing is, there are posts, not many. There are few here and there. And once they are taken, we're sitting again with no post, and we're still doctors sitting at home.
So, this is an on-the-spot question, you don't have to answer. Is this why we see a much bigger privatization in terms of the medical professional? Is you're sitting and they said, okay, I'll rather start my own practice.
Exactly. And also, So there are one of many reasons that people actually go to private. One is that there's no job for you in government where it is needed, where we have hours and hours of waiting lines and queues. So that because we have a shortage of employed doctors in the hospital to serve. Then the other reason is so that's why they're in private. Then also there are doctors who don't want to work in conditions where we don't have the tools. And they don't want to struggle to do their job. And that's why they move to private. And then, that's exactly. And why people move overseas to find jobs. Because our own country doesn't provide jobs. So we in this catch-22 where we want to build our economy, want to build our pool of professional, educated people, but we don't even support them. I mean, there's no jobs for us. Even myself at this point, I'm considering working overseas at this point because I'm like, if I get a job here, the salary doesn't equate to the amount of hours that you put in, because the South African system, especially government, if you work, for example, you are supposed to work 80 hours of overtime. Where there's a gap, a lot of the time they expect you to cover. Like last year, all my overtime, you get paid for 80 hours. If you actually 60 hours, but if you go beyond 60 or 80 in some cases, you don't get paid for those hours, but it's expected to be covered. And in the rural areas, if there's no doctor on call, if you just boycott it, there's no one in the hospital to do the job. So the patients come to nothing. And that's what happened last year. So even we capped ourselves at 80. And we actually supposed to cap it at 60 because we only get paid for 60. So essentially we work for free. And I know other colleagues of mine and friends of mine who worked more than 100 hours did not get paid for that. So you find people working in conditions where they're not even getting paid. So we are expected to do our job, not get paid for it also, and then get a salary that doesn't reflect the work that we actually do. So why must we work so hard here when we can go overseas and get paid for what we've worked, and even better? So there's lack of employment here. The salary, especially in government, I'm not talking about private now. Government, all your hours aren't essentially covered. And you work under suboptimal conditions. Who, if you look at that picture, would you want to work in government? You see? So we're dealing with this very difficult scenario here where we have doctors sitting at home, skilled, educated people sitting at home looking for jobs. At this point, I can only manage to get locum, which is just sessionals where the government, or not the government, these health facilities do employ sessional doctors. So it's not a full-time employment, it's just sessions, and they pay them privately in that way. And that's how sometimes they can keep or make the workload a little less, but they can't offer formal employment. So for example, this month I'm working at 4 or 5 different places just to get a decent amount of money to cover my expenses. And it's not a salary, it's little wages here and there. But we're sitting at home and looking for these sessions because it's also not easy just to find them. Yeah.
Right. So the next question, and I think you've covered a lot of the thing, especially the last question. Challenges doctors facing, is there something general public needs to be aware of? I want us to just reflect on it, on that specific thing. So now we're aware of what you guys are experiencing. How can we help out? How can we, the general public, who is the beneficiaries of the healthcare system, help out in this instance?
Sure. I think healthcare is actually it's a service So healthcare providers provide a service, and it's very difficult to say what our patients or clients must do for us. But I think patients or clients need to be cognizant of what the actual system is about, what it is facing, what it is lacking, and the treatment they receive. I must say, because of our overpressured health system and the large responsibilities and weight that's put on certain health professions, it trickles down even to the service and quality of service we provide. Because a doctor who's working 36 hours plus can't give you optimal treatment as someone who just woke up this morning with 10 hours of sleep. To be realistic, you're not going to get the same service. There are studies that have been done in the Western Cape where they've shown that someone who hasn't slept for 24 hours is equivalent to someone who's drunk. But we are expected to work in those conditions, and that's why the Western Cape actually has capped it to 24 hours. And so he's facing. So I mean, I don't feel comfortable treating patients in that state, but we must. So what I tell the patients or the clients to understand is that, you know what, when you're complaining of the 10 hours that you're sitting there waiting in line, believe me, it's not because the doctor didn't want to help you. He was busy with probably 50 people, not 100 before you. And he's probably still not done. And by the time they get to you, they really don't want to hear you complain of how long you waited. Because it's not even personal at this point. It's a system that's not supporting. It's staff. It's a lack of support and structure. So, and also if there are campaigns out and around to actually participate in the support your health professionals. Also say thank you when you finish. Like, I mean, something simple as saying thank you. You never believe it, but I can go through a whole shift and no one even says thank you. And it's not because I want to be praised for the work that I do, but it's a very thankless profession, and you will never imagine how much that means to that professional, the nurse, the cleaner, the doctor, anyone who's working in health. They deserve that common courtesy, you know. And yeah, just to be cognizant of waiting times. We don't deliberately make people wait. You will hear people shouting, oh, I've been waiting here 10 hours, I still didn't get help there. Or I was here before that person. And the thing is, I was here before. We have something called a triage system, where we triage people according to how severe the illness is. So we see the sicker first, because they need help sooner. And I know patients don't even understand that a lot of the time. So it's just to be cognizant of the system you are receiving. And that's why you find angry doctors, angry nurses, because you find also very ungrateful patients. And it's hard to, like, I understand where patients are coming from, and it's just that it's this vicious cycle. And it doesn't help when we're not considerate of each other's challenges. The same way I know that patients sometimes travel, if they must travel from the rural areas to Tygerberg, for example, they travel the whole day. They're on the road from 5 a.m. with a bus to get here. They spend probably their entire wages for that week to get to the hospital. So I know that when I see a patient, I know they came that far. Not that I don't treat any other patient like this, but to be considerate of that. And that we also don't all come from the same educational or any background. It's not the same. To also just be cognizant of that when we meet different patients. So it's hard to say what's the correct way for me, health professionals, for clients or patients to support us. But it's also just to be cognizant that it's bigger than all of us, and that we all come at the end of the day and come to the hospital or come to your clinic with different backgrounds and different experiences of how they came to that point, if that answers it.
It answered it
Yeah.
brilliantly, and this is where I'm going to stop our conversation.
Mm.
And I want to end it off with a thank you. Thank you for the work that you and many of your colleagues are doing. I think today you've shared much deeper insight. I don't think people have conversations with doctors. We think they're this super humans that is trained to work the 20, 24, 36 hours, but it's a system with so much pressure. It's a system of life and death decisions, and it affects doctors, and whereas to go back to families and people, and you have this, like you said, a vicious cycle. So I want to thank you. I want to thank you for the work that you're doing. I appreciate it, and I know many people after watching this, they too is going to appreciate it, and I think they're going to be show that appreciation after watching this. I think a little bit more, and then I will have one of my run and cut sessions where I'll speak about this. Is that we need to give attention to the healthcare system in South Africa, and we have to do something about it. We cannot just sit aside and just expect that a broken system is going to fix itself. If this system was fixing itself, then it would have been fixed. But the system is broken, and it means if it's broken, then we have to fix it. And I've put up my hand. It's like we have to do something about it. So thank you very much, Salwah. I appreciate this.
Thank you, Jacob. I appreciate you for inviting me today.
Thank you.